How has this past week gone for you?
We have never seen anything like this before. Not in this town. We have never seen anything like this.
Can hospitals handle the current number of patients?
We are working every single day to expand our capacity. So as of today, I can tell you that we can take care of the influx of patients. We're getting doctors, nurses, respiratory therapists, nurse practitioners who are coming from all over the country and are today with us here at UMC. We're putting requests to get more of them because they don't live here, so they come in and out. So we can have the right flow of people and staff in order to take care of patients. So it's hard, but we are working diligently, day and night, so we can make this happen and we can continue to care for our patients.
What should people at home be doing right now?
What should people at home be doing? That's the question everybody asks. The question everybody knows the answer, but what nobody wants to do. And actually, I will personally pass a message from all my colleagues, the nurses who I work with as well, and is stay home. We saw recently that the local government stated that they don't have the capacity to shut down the city, that only the governor can do that, right? You know who has the power to close down the city? You, at home. If you don't go out, you're closing down the city. And this is exactly what we need to do right now. There is nothing else I can tell you. There is no reason at all having hospitals like in the state that they are right now, having to bring people from other cities to work in our hospitals, to tell you to go out and have dinner and go out and go to a birthday party, when that can probably be the last birthday party that that person can have. So there is absolutely nothing else that I can tell you than stay home, just go out for the bare minimum. If you have to go to work, just go do that and go back home, and don't expose anybody unnecessarily. So that's what you should be doing at home. You can shut down the city. Only you can do that.
What's the most eye opening thing you've seen this week?
Being in a patient's room and actually knowing who that person is, because we see hundreds of patients per day, and uh, people sometimes don't get how physicians and nurses and every healthcare worker, we try to put this barrier so we can do our job and we can be effective and we can be aggressive, and at the same time we try to connect, but the connection is always is professional, right? But having people who you know in a bed and you being the doctor, seeing their fear, uh, knowing that these are the only hands and the nurses, that the only hands that they can grab, and you don't even know if that is the last time that they will grab somebody's hands, and it has to be you, it's not their loved ones. It's heartbreaking. um, how you have to keep them positive, because everybody needs to stay positive. We can do this, we can beat this, but we need also that uh, push from everybody, um, to stay positive, to know that they can heal, to follow the instructions, but knowing that they are afraid, and they are afraid, and there are enough reasons for them to be afraid. Even we are afraid for ourselves, for our family members, for everything that we're seeing day in and day out. There is no reason why somebody should be in a hospital in this condition by himself or by herself. There is no reason for a person to be at home dead worried about their family members not being able to know what's going on, because with the volume it's difficult to keep up with all the phone calls from all family members. So they can be there not knowing if their family member will make it. That's it's no reason to do that. There is no reason for anybody to go through that. Not at home, not in the hospital, not for us, because it really breaks our soul, and we cannot do our job this way. We need to stay strong for you guys, and that's what we try to do every day. But we need the help. We definitely need the help.
What's your prediction for next week?
We will be busy. 2021 is not the end of coronavirus. Okay, so the virus is going to continue. The virus is going to step into 2021. The volumes are not coming down right now. If you're following the positive cases per day, you can see how um, there is no way the hospitals are going to get in a better shape over the next 4 6 weeks, maybe.
What is giving you hope at this time?
How people are stepping it up. I mean, we have a lot of physicians in the community who are calling us to come and help us, to help around the community in hospitals, and that is something that is definitely heartwarming. It's good to see nurses who are coming out, also offering their services. We need all the help we can get, and if it's local, it's better because it's easier. You guys are living here, so we can definitely use your help for longer periods of time because we don't know when this will end.
What's your message to the borderland?
My message to the borderland again is only you can control this. We're the firefighters. We are the ones putting out the fire, but you are the ones who can prevent the fire from spreading. Stay home. Stay home. It's granted that you have to wear your mask, wash your hands, social distancing. We have been talking about this, but it is completely unnecessary at this point with the severity of this situation for you to be out there socializing. No reason.